want to welcome everyone here today. Ruth and I are both pastors, which means that we're going to start exactly on time with all of our intentions, and then we'll probably end up being 4 minutes late, right? That's
That's about right.
Yeah.
Even
Well,
YouTube doesn't premiere things right on time. So, you know.
well, that's a good as introduction as any. So as we are getting started into this, I here at the beginning, we can give a little introduction as to who we are and what we're doing and what you can expect for this hour, as well as what you might expect for the next, who knows, 6 or 7 or 37 weeks, depending on how the topics go and how the pandemic unfolds. Because as we've heard said several times, we are not on our own time. We are on Corona time right now. In fact, I am advocating that we just own it, and we call this the liturgical season of Corona Tide. So you can feel free to use that without trademark. So that's fine. So I am Reverend Zach Jackson. I am the pastor at Community UCC in Reading, Pennsylvania, about an hour outside of Philly. I am not a scientist by training, but I play one on the internet. I am one of the hosts of the Down the Wormhole podcast, which is a weekly podcast exploring the strange and fascinating relationship between science and religion, with a number of my friends and colleagues. And I am also a member of the UCC Council for Climate Justice, and do seminars in the area on issues of science and of faith. And this is kind of my pet passion, if you will, of helping people in the church to understand issues of science and to integrate it into their faith and into their life and into their work in the church as well. And so to that end, when this all kind of started to happen, we decided to put this together. And I say we, and by we, of course, I mean my good friend and colleague, Ruth Shaver. Ruth, you want to tell us a little bit about yourself?
Sure. I'm Reverend Dr. Ruth Shaver. I'm the intentional interim at First Church of Christ Congregational United Church of Christ in North Conway, New Hampshire, where I'm a short timer because we have called a new pastor who happens to be one of Zach's colleagues in the Pennsylvania area. And I have been a science geek all of my life, although I am also not a scientist by training. I grew up with Nova and Nature and Mutual of Omaha's shows and read every book I could get my hands on about all kinds of science. So for me, the passion is making sure that people of faith understand that science and faith are not in any way incompatible, but are both ways that we can explore and come to understand and care for the world that we've been given by our God. So this is a passion of mine as well. And I should say that Zach and I met at General Synod at a Science and Technology Network event that Zach had put together. There is a UCC Science and Technology Network. You are more than welcome to join us on Facebook. Just look us up, we're there. And what's funny is that he introduced me to the Science and Technology Network, and I introduced him to the Sinai and Synapses Fellowship, and we are both alumni of the Sinai and Synapses cohort 2017 through 2019. And it has been quite an amazing journey. I do want to say that I'll be monitoring the Q&A. So if you have questions to ask, I will take care of those. If we don't answer them this week, we are planning to do this for several more weeks. And as Zach said, as long as there's interest. Zach's going to do a large part of the talking today, but I'll be monitoring the questions and feeding them to him as they come up. And I'll also be taking care of making a list of questions that people might want answers to, if there are answers, which is another piece of science, in the coming weeks. So Zach, back to you.
Thank you, Ruth. Thank you for the plug for the Science Technology Network. I put a link in the chat. You can find that over on the side if you'd like. On that network Facebook page, we have an ongoing thread about questions about COVID-19 and church and just about it in general. So this is something that we're trying to work out together. So the purpose of this webinar and all future webinars is not to give us the answer. And I want to be clear about that up front. This is not an attempt to give you, X, Y, and Z. If you do these things, you will definitely be safe. Science tells us that if you do these things, then you and your church will be totally fine. Because if anything, a lot of the stories that I'm hearing coming out of these churches that opened early are that they keep saying things like, we did everything we were supposed to do. I don't understand how this happened. I hear this story all the time, right? That I don't know how this happened. We did what we were supposed to do. We followed CDC guidelines and we still had this breakout. What did we do wrong? And it's almost like we've traded one certainty for another. And we treat science as if it is a tablet of commandments that have come down from on high. And if we just follow these things, then we will be safe. But for many of us coming at this pandemic now, we are just now being introduced to science as it works for the first time since probably high school. And even then, unless you had a really good science teacher, maybe you only learned science as a list of facts and figures. Maybe all you remember of it is that the mitochondria is the powerhouse of the cell, right? That was really all I remember from biology class at the time. So what we want to do with today and the next several weeks is that we want to equip you with the tools that you need to navigate the ever-shifting world around us in terms of what the new research coming out is saying, and in terms of what the experts are saying, and in terms of what all the new data and the new findings and the ways that this virus is evolving as well. And so to begin, I want to show you one of my favorite toys. Some of you have one of these. This is a Leatherman. I got my first Leatherman when right before I got married. Actually, it was the Christmas before I got married, and my father-in-law bought me one. And I kept it on my belt at all times. This thing is great. It's got like 13 tools in it, built into it, scissors and screwdrivers and whatnot. For what it does it super well, which is to do a lot of things all right. This is not my first Leatherman. I have broken my first Leatherman because I got into a situation where I really needed a screwdriver, and the only one I had on me was the one that's on here. And I know that this screwdriver head is not designed for heavy torque because it's designed to do a lot of things decently well. But instead, I just really went at that screw and just snapped the top off of it. And then I did the same thing to the chisel tip, and then I messed up the blade and all of these things because I was using this tool beyond its capability, beyond what it's actually designed for. And we're kind of doing the same thing to science right now, unfortunately. Because science is really great at what it does, but we really need to understand what it is first. Because despite what you might remember, science is not a set of beliefs. It's not a set of facts. It is not some oligarchy of authoritative people up in some university somewhere who dole out the truth for the rest of us to absorb. Science, put just most simply, is a way of interacting with the world. That's all it is. It's a worldview. It's a mindset. It's a set of tools. And yes, to answer the question, we're using face masks today as a way of, as the case study. I see that in the chat. Give me a sec. I'll get there. Trust me. I'm a preacher. And so this actually illustrates somewhat well, because we want answers. We want the end result of what science brings us, because typically it does, right? Typically science, we only get the product end of science. We never see the development end of science, because science works slowly on purpose. Somebody has an idea and they ask a question, they do research, they make a hypothesis, they do an experiment, they evaluate the experiment, they publish their results get peer reviewed, their peers tear it apart and try to find all the flaws, and so that they can then figure out what to rebuild at the end of it, and then they replicate those, it goes on and on and on, and you might spend years coming up with something that ends up then being presented to the public as a mostly useful, true thing. And that's generally how science works. We don't get to see the messy underbelly, the part that that develops the truth that we find at the end of the process. And so here we are in the middle of a crisis, all trying to figure out what we're doing. Do we wear a mask? Do we not wear a mask? Do we wear it inside? Do we wear it outside? What kind of mask? What kind of this? Can we sing? Can we do this? Can we do that? And we want an answer. With good reason, we want an answer. And so we latch on to every headline that we see on Facebook that says, a new study has shown blank, or scientists now recommend blank. And that makes sense to us because that's how the rest of the world functions. But in the world of science, that's just one step in the process. And so as an example, some of you may have seen a study that came out of PNAS, the Proceedings in the National Academy of Sciences in the United States. It came out in May, and it hit all these news headlines all over the place. And the title of the article was, Identifying Airborne Transmission as the Dominant Route for the Spread of COVID-19. Now that sounds like a very demonstrable title, right? Identifying airborne transmission as the dominant route for the spread of COVID-19. And in that article, the researchers, they looked at China and Italy and New York City, and they looked at the curve of infections, and then at the date that those different municipalities made it mandatory to wear masks, some kind of face cover. And what they found was that in places where, at that moment when they said, you have to wear a mask, cases went down dramatically. And now their only other point of reference was the United States as a whole, because we haven't really done that until later. So that seemed like, all right, well, this is pretty conclusive. When they implemented this policy, good things happened. Transmission went down. And previously they had, done social distancing and shut down things and all that. So the only difference in that decline, as far as they were concerned, was just wearing a mask. And so this hit the news. It was all over the place. And if you were just looking at our Facebook feeds, you would think, well, there you go. Finally, we have definitive proof that we can make policies out of. However, woo doggy, there are a lot of people in the scientific community who were not happy with this paper, precisely because of its title, its methodology, what it did, and what it tried to say, because it may be true. It really might be true, but it can't be shown in this way. And I won't get into all the methodological problems with it. You can look it up on your own if you'd like. But there were lots of problems with this particular paper. And this particular paper chose to skip some of the peer review and use this thing called contributed submissions track, which is like an insider in that organization can choose their own peer reviewers. So you can choose your buddy Frank to review your paper, and he goes, yeah, this is great. And it gets published without it being really, truly scrutinized. And so these scientists wrote this really great letter that they say, like, this, we still think that masks are the best way to slow the spread. We still think your conclusion is correct to the best of what we know, but you got there the wrong way. You didn't follow the rigorous, controlled study that we have put into place in order to correct, to guide people to a correct place. And so this is just one time that this has happened. There have been lots of publications that have had to be retracted, not because they were wrong necessarily, but because they got there the wrong way. And so by the time, and this hasn't even been retracted yet, this is still being reviewed. Several others have been. But in the meantime, we've all seen headlines that say, scientists suggest, or a recent study proved, or scientists now think X, Y, and Z. And what you're seeing could be really good science, or it could be this kind of a thing. And it could be somewhere in between. And so we're hoping to be able to equip you to make some of these decisions and to be able to get through some of these yourself. And before I jump into our flip-floppy own CDC recommendations and what has just been the fodder for any anti-mask person so far, I want to give a space for Ruth if there's anything you would like to add about how science works in this regard, because I know you've done a lot of research in this.
Well, just to remind folks that we are used to dealing with certainty, and scientists will almost never say the words "we are certain," because science and scientists can only prove things to an extent, to the best of what's available knowledge at the time. And so sometimes we're seeking a kind of definitiveness that just isn't available and never will be available. We are getting some questions, and we've got a question that was already on our agenda for next week. There's a question now about the crisis of getting infected with COVID-19 if we're wearing masks on Sunday with no choir and keeping folks apart, which I know is part of where we're going with this. So just want to make sure that we flag that one coming up.
All right, thank you. Yeah, and if you have, remember, as questions come up in your mind, feel free to put them in the chat, or there's a Q&A section as well. And the second half of this meeting today will be just talking through some of these things. So like I said, one of the biggest anti-mask wearing arguments has been that our own government can't seem to agree as to whether or not people should wear it. And even Dr. Fauci said here that you shouldn't wear it here, there, or the other. And so they can't figure it out. They don't have truth. So you know, figure it out on your own. And I will say, January 30th was the first time they came out, and the CDC said, quote, "We do not currently recommend the use of face masks for the general public. We don't routinely recommend the use of face masks by the public to prevent respiratory illness, and certainly are not recommending this at this time for this new virus." Remember, January 30th, there were cases, there were hotspots, but it was not, it wasn't anything quite like at what it is now. February 5th, they answered again and said, "We do not think that the American public should be out buying masks. They don't need it for their day-to-day life." February 12th, they said that they don't recommend it for the general public, though anyone who is sick or a patient under investigation and not hospitalized should wear a mask. So basically, if you're symptomatic, you should wear a mask. Everyone else should not. This was February. March 9th, we're still there, where we do not think this is the time for Americans to be going out and getting masks. Masks are really important for those at high risk, and so we want to save them for others. Dr. Fauci came out and reemphasized this point back then in March as well, that we don't have enough masks, so we don't recommend the general public using them. And this is March 31st. This is not that long ago. This is about the time where we're starting to shut things down. We're probably a month into not having church anymore. And then April 3rd was when the CDC finally said, quote, "Everyone should wear a cloth face cover when they go out in public." Now, what changed? several things changed. First of all, the virus grew a lot. And we didn't understand it yet. And specifically, we didn't quite understand whether or not somebody could spread it without showing symptoms. Okay. And that's huge because with a lot of these viruses, they're really only contagious when you're coughing and sneezing. And if you just isolate people who are coughing and sneezing, then it should just go away and the rest of us can live our lives. But it was showing up more and more in places where people were not showing symptoms. And so it started to lead us to believe that, my goodness, this thing seems like it can be transmitted before you show symptoms. And now I'll preempt some questions here that a woman from the World Health Organization said to an interviewer that asymptomatic people don't spread the virus as far as we know. And then all of social media blew up when I think CNBC covered that, and it went all over the place that we don't have to wear masks because asymptomatic people can't spread it. And then she had to immediately clarify what she meant. But by that point, I think what the half-truth has been halfway around the world before the truth's had a chance to put its pants on, or something like that, someone said once. The truth is, what she was saying is that pre-symptomatic people, so people who will show symptoms but have not yet, are actually super contagious. Asymptomatic people, which are people who never wear masks, who never get sick, less likely. And you don't know if you are A or pre. So err on the side of pre is what she was trying to say. And there was a study that came out in the journal Nature on April 3rd. And this is the day that the CDC changed their guidance. And this was partially because of this study from Nature, which is the sort of study that was done really well and thoroughly and followed all the proper channels. It was a 3-year study done at a hospital in Hong Kong between 2013 and 2016, in which they got people who came in with like influenza-like sickness, and they had them sit in a room for a half hour and just breathe, just normally. They cough if they had to, but just breathe. 246 individuals, they did that. Half of them wore masks, like surgical masks. Half of them did not. And then they just measured the various amount of droplets and aerosols of the virus. So droplets are if you are in the front row of a Baptist preacher and your face gets a little wet, like those are droplets. That's the splash zone, the 6 feet zone. Aerosols are the really light ones that float around and can be up in the air for hours. So they found in this study that 30 minutes of breathing normally in this. Afterwards, they tested for various coronaviruses, because coronavirus is a family of viruses, influenza, which is the flu, and rhinovirus. And as the result, they said, quote, "We detected coronavirus in respiratory droplets and aerosols 30% and 40% of the time with their 2 studies without face masks." So without face masks, people just breathing for a half hour in a room, in 30 to 40% of those cases, they were able to pick up the virus in the air. So just think about that for a second when we're thinking about enclosed spaces, okay? Just breathing. However, in the group that was wearing face masks, they showed 0. Nothing in the air. Now, granted, that's only, what's that? It's about 123 people. So it's still a fairly small sample size, but that was pretty convincing enough for the CDC to say, all right, this is really good guidance. Masks really do seem to stop viruses from coming out and being in the air. So that's when they said everyone should have a mask. And so everyone ran out to the store and tried to figure out, like, what's the best mask? What do I wear? What do I do? Do I wear a cloth mask? Do I have a kind that goes around the nose? What about like the the allergy masks. Amazon is all flooded with these now. All these t-shirt companies are making masks now. It's everywhere. And so we wanted to take a second here. I know there's some questions out there about this, and I was going to hit this up too, that there are a variety of different masks that we can wear. Ruth is demonstrating right now a cloth mask, but I think you can only see me.
Yes, so this is actually a cloth mask that my stole maker made for me that matches a stole that I have. So when we go
Same with me.
Yes. When
this is my ordinary time.
Yes. So, our church is considering, and we're actually going to be talking about that later this week, resuming in-person worship, at least for a time during the summer outside, which is one of the topics that we plan to cover in a future episode. And I've already said that except for when I am preaching, I will wear my mask. But when I'm preaching, I will wear my face shield because people read my lips when I preach. And that's one of the hazards of wearing a mask, is that if you're working with people who read lips, obviously masks impede that. But is what's safest? What's safer? What's the best kind of thing? So Zach, there were folks asking questions specifically about paper versus cloth masks, the N95 masks, and that kind of thing. And also, it's very tough. The idea that the original statements about not wearing masks were kind of garbled. So the way that we were told not to wear masks seems to have originally been mostly about the N95s and got completely garbled, but was so garbled that nobody quite understood exactly that science that you were just talking about.
It was about not buying up medical grade masks. So that's not just on N95s, but also because people who have never worn a mask before find it uncomfortable, because it is, and it's terrible. And so people who are uncomfortable tend to touch it a lot, right? And so you go to the grocery store and you're trying to stay safe, and you're touching stuff with your hands, and your hands may have picked up some bit of virus from the things you're touching. And then you're also constantly readjusting your mask, which is then getting the virus on the mask, which you're then breathing directly in. And so the thought early on was that the general public would probably do worse if they had masks, because they don't know how to use it. And so they were kind of betting on that, honestly, which they didn't. I thought they communicated fairly well, but maybe could have been a bit clearer. So there's some questions about the different types of masks and the different efficacies of them. The first one you just mentioned is the cloth mask, this little guy. The purpose of a cloth mask is to catch the droplets that come out of your mouth. Okay, because as far as we know, the primary way that COVID-19 spreads is through droplets that come out of your mouth, not aerosols, which are the ones that float in clouds. As far as we can tell, it does spread through aerosols too, but primarily through droplets, which is why we say 6 feet away, because that's pretty much, if you're talking loud or you're coughing or whatever, the droplets mostly can only go about 6 feet. There's some estimates that it's farther away, but that's just a general rule. So anyone who has worn a mask for a long period of time will know it picks up a lot of droplets, because the inside of your mask gets wet and nasty. That's good. It's supposed to. It is supposed to protect other people from you. And in that way is basically like the most Christian thing a person can do, is to give up of your own individual comfort and liberty and freedom for the sake of the well-being of another. Like, seriously, that preaches so easily. That sermon writes itself. Plus, you can get them in all kinds of fun colors and shapes. The ones that have things around, like this one, has a little pocket up here where I put in a wire so that I can fit it around my nose. That is great because the fewer holes you have, the fewer gaps you have, the better protection you're going to have for other people. So just cloth masks are great for stopping the spread to other people. It will do nothing to help you. The other one I've seen out there are these masks that people generally wore for allergies. And you may see these, they generally have like 2 vents right here. People run with these a lot. They do less than nothing because not only do they not filter out the virus coming in, because the virus is way smaller than their allergen filters, but those vents open when you exhale. It's meant to provide good, easy breathing for people that are running outside or whatever. And so you're not protecting anyone else when you wear one of those because your breath just comes right out those holes. So if you have a mask that has the vents in it, get a new mask because you're not helping yourself and you're not helping others at that point. Now, when it comes to paper masks, there's 2 different kinds. There are 2-ply paper masks and there's 3-ply paper masks. And that difference seems arbitrary and small, but it's actually pretty huge. 2-ply masks are basically the disposable version of a cloth mask. It's usually paper or some kind of waxy paper or something that's just designed to stop droplets from coming out of your mouth. These are cheap, they're easy to find, they work all right. They work basically the same as a cloth mask. That's fine. Medical masks are 3-ply because I'll show you. They, on the outside of one of these, will have a hydrophobic coating, which means literally in Greek, afraid of water, which beads up water. So if somebody sneezes or coughs on you, instead of it absorbing into that, it will fall off, right? So it's designed for surgeons who are reaching over. The inside is hydrophilic, Greek for water loving. It absorbs water. It's like a diaper on the inside there, so that all of your spit and all of your stuff gets absorbed on the inside. And the middle one is a very special layer called a melt blown layer. It's this special way of making this plastic sort of a substance that is basically cotton candy, that in the way it's designed carries with it a light electrostatic charge that will attract viral particles and small allergen particles and all kinds of little things into it. And so that middle layer, which I've cut one open here, is what makes this solution actually somewhat better than a cloth mask. And this is one of the things that they were trying to get us not to buy too many of for healthcare people before. And you'll know that it's legit and actually melt blown because it doesn't burn, it melts. Now we'll see if that, yeah, see? It's not burning, it's melting. This is legit. So my wife just bought a pack of these and I just burned one of hers. She's got 49 more. I'm sorry, Nicole. But now we know this is legit and it smells awful, like burnt plastic. But these will provide a little bit more protection for the wearer. So it will filter out some particulates. Not a lot. So don't go buying up 6,000 of these. But they are better than the 2-ply, okay? Because they're meant for hospitals. The problem with the shortages early on was that a lot of our medical supplies have a really long supply chain. So, you know, one company will make the outer layer, one will make the inner layer, one will combine them, one will do this. And a lot of those manufacturers are in Italy and Europe and in China. And then when the virus hit and people couldn't go to factories anymore, our whole supply chain fell apart. So that's starting to come back. And so it's okay to go online and buy some disposable masks for your church and whatnot. Now, The N95, the one we hear a whole lot about, I don't have one, obviously, because I'm not a doctor and I don't need one. They're not even masks by definition. They're respirators because they go completely around your face. They form almost a airtight seal around your face. And you need to have training in them to get the proper fit. And they usually have a vent on them as well, because otherwise you would suffocate in there. So N95s don't protect other people from you, but they block 95% of incoming particulates. That's what the 95 means. So people were going out and buying these from 3M, going wherever they could find them. And it was really hard for hospitals to get them where it's really, really needed. And so I have friends who are nurses who are having to reuse these masks that are supposed to be disposable. There are floors of hospitals that are sharing them, which is disgusting. There's attempts to decontaminate them with UV light, which is somewhat working. I see a question from David Russell. Are 3-ply available and are they reusable? They are available. Like I said, Nicole bought these on Amazon, I think. They're from a company called Mawe. Generally speaking, I know we have this trope that things that are made in China are cheap, but when it comes to medical supplies, stuff made in China is actually really decent. And you're looking for it saying it is a three layers, and there we go. It even says it on the side of the box, 3 layers. They are not reusable. So do not reuse them. And anytime you wear a cloth mask, you should wash it because you got stuff all over it, and that's gross. And the virus can live for a couple days on one of those, and so just play it safe. So Ruth brought up shields, face shields. Mine's in the basement covered in sawdust because I use it for wood turning, so I didn't clean it and bring it up. I've seen people use these. If you go to a restaurant, you see them all over the place. There are currently no real studies either way. You really have to reach far back. Closest ones I could find were from 1986 that were studying doctors and nurses in a what is it, NICU, where they were taking care of infants with respiratory disease, and found that if they wore goggles, they were more safe than people who didn't wear goggles. The idea being that you're not going to touch your eyes and that it's a protection for your eyes, whereas masks just protect your nose and mouth. Some of the benefits of shields are that you don't touch them because they don't touch you. And so you're not going to be fiddling with them all the time. They're reusable. Just clean them off with soap and water. And they do stop a lot of the large particulates. I know Ruth was telling me before that she wore them for a while when you were doing the voting, right? When you were at the polls, and then you had to clean it how often?
Yes. Well, so our town did drive-through elections at the town garage, and I was checking voter IDs. So I was interfacing directly with people and was wearing my shield. And I was having to clean the shield about once every 3 hours. And that was just talking with people. When we were putting this together and doing different things, I did actually sing a little bit more than when we were talking earlier last week, Zach, in my shield. And I had to clean it off after about 20 minutes. Now I have really good diction when I sing. But that was telling. So if you ever want to prove to people that that everybody spits when they talk, put a face shield on them. It really does prove the point. What was interesting about the shields is that it made wearing the masks more comfortable at the times that I did wear the mask while we were in the voting, because I wasn't as conscious of the mask. So I wasn't messing with the mask as much. And that was really helpful. David, your question, are shields effective in protection? That's an open question. We don't know the answer to that. We do know that when doctors are intubating COVID-19 patients to put them on a ventilator, they mask, they shield, they glove, and that is standard procedure for any kind of respiratory infection. So how effective they are independently, like Zach was saying, you have to go back to the goggles study. Who knows, there may be a study in process right now. But.
There are no published studies right now on the effectiveness of plastic face shields for stopping infectious disease on their own. There are only simulated studies in which they use computer models to figure out, particles that fly all over the place. So if you want, so that's really the only downsides right now, are that there's not a whole lot of certainty as to how effective they actually are. And this is also true for, we've seen people trying out like big plexiglass shields in front of pulpits and whatnot. Those do seem very effective in stopping the droplets. If you have a shield in front of your pulpit, the droplets aren't going to get through. Any of the aerosols that you create will, but you're kind of hoping that by the time that those aerosols make it to your people, that they're diffused enough that it's not going to cause an infection, because you need a lot more than just like one little SARS-CoV-2 virus particle to really infect a person. You need a certain viral load before the body kicks into this response and you get infected. And so it's all of this is just about mitigating risk. Everything you do carries with it a degree of uncertainty, and we are still working out the details of that. What I will say is that on the flip side, the big complaints against masks, and this is something that somebody had asked in the questions as well, about why they keep seeing YouTube videos of scientists and doctors who come out saying that masks will give you CO2 poisoning and will kill you. There was a man in New Jersey who fell asleep at the wheel and crashed into a telephone pole and told the cops that it was because he was wearing a mask and passed out. And that's still up in the air as to whether or not that actually happened. But if you are wearing an N95 respirator and you're not used to it, and you wear it for more than an hour in an enclosed space especially, don't do that. First of all, you shouldn't have an N95. Second of all, even the professionals are urged to take a break every hour or so, because it's such a tight shield around their face. If you are wearing one of these, or if you are wearing one of these, then there is enough gap around the top and the sides, which is what makes it ineffective to begin with. But there's enough gap there that the atmosphere around you will be rushing in. You can't create a pocket of CO2 large enough to harm you. Unless you are hypersensitive to CO2, if you have asthma, COPD, some of these sorts of respiratory problems, there is no evidence out there that wearing a mask is detrimental to your health. And unfortunately, we live in an age where anyone can have a platform and anyone can say whatever they want. And it carries a special weight if you have letters after your name and you are willing to say something, and especially if you can claim that somehow Bill Gates is behind it all and there's some conspiracy theory. And I think we're all stuck in this cycle of grief right now, and we're in this like bargaining stage where we think that, oh, well, if we only can just do this, then we'll be okay. If I can just wear the right mask, if I can just do the right thing, say the right thing, believe the right thing, then I'll be fine. But we need to work our way past that and into the acceptance, because in the acceptance, then we can make best practices for us and our people. Yeah, jump in, Ruth.
Okay, so a couple of questions are popping up here. So the first question is the three ply are more effective than cloth masks, and yes, that is true, especially if they are the medical grade, because the medical grade are specifically designed for that.
Yes, but it's worth clarifying that we're talking about like small percentage difference here. We're not saying like if you wear this mask to the grocery store, you're going to be fine. If you wear this mask to the grocery store, you're going to die. Like, I want to make sure we're clear that we're not talking about binary thinking here. We're talking about degrees of certainty, because science operates under degrees of certainty. So,
yes. And also, if you have a cloth mask that has a pocket for filters, you can make it safer along that spectrum. So mine, for example, has a pocket, and I'm using coffee filters just folded in half because they fit nicely. They're breathable, and other than crinkling a little bit, they're fine. And it may only be psychological. It may be a placebo effect, but I feel safer wearing my mask with my coffee filters than I do just wearing the 2 or 3 layers of cloth as it's folded.
You're right. The coffee filter does actually help a bit more. You can also buy that melt blown layer just as a fabric, and online usually, and then you can insert it into that pocket as well. If you don't have that, napkins and paper towels work as well. Something that is just there to absorb and to stop things from moving as freely. I heard a scientist the other day say that if you wanted a cloth mask that had as much ability to filter out particles as an N95, you'd need something like 36 layers of cloth. So don't do that, but the little filters can help.
Yes.
And as close to 100% cotton when you're making the masks is really good. You're looking for at least two layers, though 3 layers of cloth is good. If you can use like quilting fabric, I've heard very good things about that.
Okay, so we've had a few questions. Let's see. Oh, there's another one here. So somebody asked if we were suggesting that pastors wear a face shield to preach. So I personally am going to, just to model the kinds of safer behavior, even though we're unclear as to how much of a difference it makes. I'm also going to do it because, again, diction, and I know that I spit when I speak, to wit my computer screen right now. A lot of that depends on how close you're going to be to people. If you're maintaining that 6-foot difference or more, you might not need to. I've seen suggestions that up to 15 feet, and I think, Zach, didn't you say that a minutes ago? 15 feet between a speaker who's projecting at any weight is good.
You also have to take into consideration the elevation of your pulpit at that point, because the higher you are, the farther it's going to spread. But yeah, roughly 15 feet from preaching.
Right, exactly. And not only that, but if you're using a microphone, you don't have to project as much. So you may not need the face shield. I will be projecting over a microphone because where we will be having our outside services, if we get to have them, there will be traffic noise that I will try to be competing with. The other question that keeps coming up, and we actually have hopefully in the works in a couple of weeks, a specific episode on this, is singing in the masks. Now, I'm going to tell you a specific story about our specific circumstances here at this specific church in this specific town. And I want to be very clear that these are decisions made on our specific circumstances. So in New Hampshire, we have been allowed to have groups of 10 or fewer since probably early April. After Easter, we, with full and clear guidelines on who was coming in when and what we were doing to expand our quarantine bubbles, our choir has been recording in our sanctuary for about an hour at a time, once a week. It's the only risky behavior that anybody in that group has been participating in. We have really good ventilation in the building, and our county case count is standing at 52 right now since this whole thing started. Our town case count is 10. Those are very specific circumstances. And we had set very early on some suggestions of when we would be uncomfortable to continue doing that. Now we've ended our choir season, so we're no longer doing that. One of the things we will be talking about at our diaconate meeting coming up is, do we sing masked, shielded, whatever the case may be, outside? And if so, do we ask people to look down at their hymn sheets and sing softly? Because we just don't know if there's a safe, safer, safest line there, or if, these are all questions that we're going to be thinking through. And everybody's circumstances are going to be slightly different. And you kind of have to go on the best available information. The other factor in this is that I did have a staff member who spoke with his doctor, and his doctor said as long as the building is well ventilated and the case count remained low, the doctor was comfortable with that under those very specific circumstances. So that individual risk, and we eased into it. It was not something that hey, everybody come and do. So yes, we are working on getting an episode specifically about singing. We are looking for an expert to come and talk with us about that, and about why singing is at the top of the risk list in terms of the evidence so far about transmission.
Yeah, thank you for that. We're probably looking at that in just a couple of weeks because it's like, it makes its way into every question that we have, right? I've seen it come up here. It was when we did the Science of Return panel a couple of weeks ago, came up a whole bunch of times as well. As a pastor, I'm there with you. Before I was a pastor, 10 years as a worship leader, like, this is my thing. This is my favorite part of church. I hate hearing myself talk. I'd much rather just be singing the whole time. And so figuring that out, we want to do a whole episode, not just about best practices, but then creative ideas about what other churches are doing instead, if they've chosen not to sing. What are we doing instead, so it's not just an empty blob in the service? So you'll want to make sure that you are aware of keeping up with that. And I think here we're nearing the end. There's another question here about air conditioning and windows, which is a whole other topic that we're going to cover as well. I want to give you just a little bit of a sneak peek about what we're going to do. We're blocking off this time every week, every Monday from 3 to 4 Eastern. We have 7 topics that we have picked out, and we're open to squashing them together or of expanding them as well. Like I said, as questions come up, we want to engage with them, and we don't want to give you just the answer. We want to give you best practices and why we think those are best practices. We're going to bring in some experts on topics that we are way out of our league on as well. And so I want to give you just a little bit of a sneak peek. I think next week, and Ruth, you can correct me, we had talking about the difference between and the risks of and the opportunities of the difference between indoor and outdoor worship. Since we're in the summer, I see a lot of churches already meeting outside. There's a lot of different ways to do it, and there's a lot of different risks and benefits to both of them, right? And so we're going to do that next week. And then the week after, as long as we can get the guests that we would like to, we're going to be talking about transmission via fans, air conditioning, windows, best practices in terms of HVAC systems, because this virus is going to be with us as well as we move into our heater period of the year. And then in no particular order, we'll also be talking, like we said, about singing and choral reading, contact tracing. We'll be talking with chaplains and other healthcare professionals who are witnessing the worst of this and what they can teach us. Caring for people who are experiencing trauma. We'll be talking about testing and vaccines. My doctor is just about to order me an antibody test since I am on day, oh, what am I on, 70, 80 something without a sense of taste after I recovered from COVID-19. So we're going to finally get to do some fun individual science. Woohoo! We'll be talking about how to help kids deal with this, assessing your own risk, disparities in racial and economic impacts from COVID-19, and any topics that are deep in your heart and in your affecting your ability to lead your people. Please send it to us via email, via Facebook, via carrier pigeon, or however it is that we're communicating these days. Ruth, do you have any parting words for us before we go?
Well, I'm putting my email address in the chat window, but you probably received an email from that from that address anyway, because I'm the email co-host for this. We will track the questions, and the question came up about faith formation specifically. Yes, when we talk about helping children, faith formation will be a part of that, but I would imagine that we will also probably have a need for one just addressing faith formation generally as we approach September. But I will also say that I'm hearing from a lot of my faith formation friends that they're waiting to see what their public schools are going to do and use that as a guideline. So just know that that's one thing that's being tracked very carefully. And also, speaking of faith formation, reach out to your conference faith formation folks and reach out to the Association of United Church Educators. They have amazing resources. And I also want to plug one other thing. I am on the board for Pathways Theological Education Incorporated. And one of the things that we are considering doing that's very tangentially or very early in the planning stages is a deeper dive into some of this to help people really understand the science behind making these decisions and that kind of thing. And maybe Zach will help me out, maybe some of my other science or Sinai and synapses friends too with that. So that's all I got.
All right. Well, thank you to Brooks for putting this together, and for Andrea for being our tech whiz and making sure that everything worked according to plan. Make sure that if you found anything helpful in this and you want to share it with anyone, there's videos available from now until the end of time, or the end of YouTube, whichever one comes first. So feel free to share as much as you want, and hopefully we will see all 130, and if not more of you, next week as well. So
yes,
God bless
you all. It was 131 at the highest count. So thank you. And yes, we will be back next week. So please spread the word if we've been helpful. And like we said, if something comes up and you want us to try to address it, we're here for you. Andrea, we have a question in the chat. Is it the same Zoom link next week?
I'm actually unsure of that, but I believe it will be a new Zoom link, but I'm sure Brooks will reach out with that information.
Okay, so watch for an email next week, and we will also make sure that you join the Science and Technology Facebook page. There's a link very early in the chat to that, and we will make sure that any updated information gets posted there.
Great.
And friend us on Facebook too.